What we have here is not just a failure to communicate. We have a failure of understanding, a failure of empathy, a failure to see the lives that have been saved by public health, and more importantly, to act on the public health action that's needed to save lives that can be saved.
The only thing predictable about flu is that it's unpredictable. Even in an average year, flu kills tens of thousands of Americans and sends hundreds of thousands to the hospital. It's not the common cold.
It's more efficient to stop diseases elsewhere when and where they first emerge, rather than have to spend more money with more risk to fight them here in the United States.
I began a process called cohort reviews, where I would go to every part of the city, meet with all of my staff, and we would review the patients one by one by one.
You don't have the kind of control over the agency that I did as New York City Health Commissioner. I had literally 20 times more flexible funds as New York City Health Commissioner than I had as CDC Director.
Efforts to undermine confidence in vaccines are really problematic because they mean that we're at greater risk for diseases that can be disabling or deadly.
When I got to New York City, I realized we didn't have an information system that would allow us to track the leading causes of illness and death. We had some rough information, and that showed that the level of smoking in New York City had not changed in 10 years, rock solid, about 21.5% for 10 years running.
Given the amount of interest, attention, and concern there was, our mandate was to get the risk in this country as low as possible. And that meant setting up a system that had never been done before.
It was a mutual accountability session. They would hold me accountable for making sure that they had the tools to do their jobs, whether it was outreach to doctors, clinics that worked, a way of reaching the patients, support for patients, and I would hold them accountable for ensuring that the patients are the VIP of the program.
New York City showed that you can fight the tobacco industry and win, that you can help hundreds of thousands of people quit smoking, that if you go smoke-free, it doesn't hurt business and it does protect workers, that you can increase taxation and get more revenue and lives saved.
How close we were to a catastrophe can't be overstated. It really was possible at that point that Ebola would get completely out of control in Lagos, Nigeria, and Africa. And if we hadn't tamped it down in West Africa, that kind of export that happened in Lagos could have happened all over.
Vaccines are essential for health. When the Secretary says it's an individual choice, well, it's certainly the case that every vaccine is given after informed consent is signed. It's also the case that whether one person gets vaccinated can very much influence whether another person, such as a child with leukemia, gets sick.
Most of the deaths would have been prevented if vaccination had been able to reach more widely our seniors, our vulnerable population, and yet, despite that terrible failure, and yet, the best estimate is that the vaccines developed by NIH and industry and implemented with public health programs and providers all over the country saved 2 million lives.